Hello, we are Carmen and Mireia, and we are going to talk about the stem cells therapy for Asherman syndrome in this presentation.
First of all, we are going to talk about stem cells. Stem cells are capable of dividing and differentiating into several specialized cell types, not only morphologically but also functionally. According to their location, can be classified into adult, originated in the bone marrow, embryonic, derived from the blastocyst, umbilical cord, gotten from the blood that remains in the placenta and umbilical cord after birth, and amniotic, extracted in the amniotic sac by amniocentesis. According to their capacity for differentiation, can be classified into unipotent, able to generate a single specific cell type, multipotent, able to produce a limited range of differentiated cells according to their location, pluripotent, able to be developed into different cell types or tissues of the body, and totipotent, able to form the embryo and the placenta trophoblast. Stem cells therapy, also known as regenerative medicine, promotes the repair response of diseased, dysfunctional, or injured tissues using the stem cells or their derivatives. The menstrual blood stem cells therapy is chosen because endometrial and mesenchymal stem cells are found during the woman's menstrual cycle and are characterized by the ability to regenerate and differentiate into different types of tissue. As we can see in the photo, the mesenchymal stem cells of the menstrual blood are differentiated into different types of cells. And now we are going to pass to the next point. Asherman syndrome is an endometrial damage disease described by the gynecologist Joseph Asherman, also known as intrauterine adhesions, that is a condition characterized by the formation of scar tissue inside the uterus. This scar tissue can cause the walls of the uterus to stick together, reducing or completely obliterating the uterine cavity. The most common cause is trauma to the endometrial lining of the uterus, which can happen during or after procedures such as dilatation and curettage, usually used to treat miscarriage, infections like endometritis, surgeries such as myectomy or cesarean section, and radiation therapy like treatments of cancers that can lead to the formation of scar tissue. The symptoms change depending on the severity of the adhesions, but common things include lost functional endometrium, pelvic pain, the menstruation is blocked, and the blood is trapped in the uterus, menstrual irregularities like hypomenorrhea or amenorrhea, uterine cavity obliterated by a scar tissue, it could be partial or total, recurrent pregnancy loss, increased risk of miscarriage or infertility, causes difficulty in the implantation of the embryo, as well as obstetric issues, placenta previa or accreta. It's diagnosed through imaging techniques like hysteroscopy, direct visual examination of the uterus using a small camera inserted through the cervix, or sonohysterography or hysterosalpingography. These are specialized ultrasound or X-ray imaging techniques used to examine the uterine cavity.
So then we have the method, and I will explain this from these images. So the first step is prepare and identify the menstrual blood stem cells that we chose before. So we are going to collect them. This takes place in the second day of the patient's mens with a catheter rinsed by penicillin or streptomycin. The samples were transferred to phosphate buffer saline containing penicillin or streptomycin and heparin. Then the stem cells are isolated, and then the stem cells are preserved in a culture medium, which is going to be changed every 3 or 5 days. And moreover, the cells are going to be passed by trypsin digestion after reaching between the 80 and the 90% of confluence. In the fourth stage, the culture is going to be collected after a period of 14 days approximately, in which has to be 2 changes of the culture. And this collection is going to be sent to a clinical laboratory for testing of bacteria, fungi, lipopolysaccharides, and hepatitis virus. After this procedure, if the laboratory result is positive in microbial contaminations, the sample will be abandoned. If it's negative, the therapy will continue. Once the sample is prepared, the autologous transplantation can be done. But the day before, the stem cells phenotype is going to be identified with a flow symmetry, and also a mild scratch of the endometrium is going to be done before the intervention. So, the transplantation is going to be on the 16th day of the menstruation in a lithotomy position of the patient. It consists in a transvaginal probe that will be inserted into the cervix, guided by transabdominal B ultrasound. Then, an internal cannula, which contains the cells, is going to be delivered through the cervix to the fundus of uterus to instill them. Finally, the result can be unsatisfactory. So, in this case, the next round of cell therapy can be done after 3 or more menstrual cycles. Okay, now we are going to talk about the advantages and disadvantages of this therapy. The first advantage is the regenerative potential of the stem cells, as my mate said before. The therapy is less invasive, reduces the recovery time of the patients, and it is associated with less risks. So, it's a minimal invasive treatment. Then, it results in an improvement of the menstruation duration, the pregnancy outcome, and the endometrial thickness. The treatment is also based on the specific needs of the patient, so it's an individual therapy. And to finish, the advantages: as an autologous transplant, there is less risk of immune rejection. And this also means that the cells are in a familiar environment where they can easily survive and proliferate, so the result is better. On the other side, the disadvantages are the first one, that there is a need of more experimental stages and clinical trials to see if the therapy is the best option to treat a syndrome like Asherman syndrome. Then it is not covered by insurance, so the patient has to pay the therapy by himself. And finally, as with any medical procedure, obviously there are risks involved, such as infection, procedure complications, or other reactions to the stem cells that can appear in the treatment.
Finally, in this slide, we can see the references about our information. Thank you very much.